Now, we're going to start at the beginning up at the top here. So as we head up towards the top, we actually have this kind of large structure right here in this area right there. And this is actually the larynx right there. So we have the laryngeal region here. And if we turn this off to the side here, you can actually see we have this kind of large cartilaginous structure right here. And this, of course, is the thyroid cartilage. So that's what that is. So the blue pen is labeling the thyroid cartilage. If we turn this a little bit to the side here, you can actually see kind of a pinkish, brownish structure here. And this pinkish, brownish structure that is sitting on top of the thyroid cartilage. You can actually see it right there. And then the yellow pen is actually pinning it. And that, of course, is the thyroid gland right there. So the yellow pen is labeling the thyroid gland. Then as we come downward, we have, of course, this white pen pinning this structure that kind of looks like a striped structure there. That, of course, is the trachea. And then the trachea comes down and heads towards the lungs. It reaches the site of carina where it then splits to form the primary bronchus, which of course we can't see because all of this is in the way. However, what we can see is as it heads towards the lungs, it will actually separate to form what is called the secondary bronchus. And so the secondary bronchus is actually visible here as this little white structure right here. So right there. And you can actually see that the red pen is actually pinning it right there. And so that's the secondary bronchus, also known as the lobar bronchus, because it goes towards the different lobes of the lungs. Right there. Okay. Now, if we were to then move a little bit up above the lobar bronchus, we would actually find a smaller structure coming off of the lobar bronchus right there. And this little smaller structure right here, which is kind of a brownish pinkish structure right there, and it's actually pinned by the black pen. That is the tertiary bronchus, also known as the segmental bronchus. Okay. Now, over here we have this green pen, and this green pen is labeling the blue blood vessel here, and that of course is the what? Pulmonary artery. Fantastic. Blue for the lungs is the pulmonary artery, red in the lungs is the pulmonary vein. Okay, off to the side here, on the side we have of course the ribs and the rib cage. This blue pin right here is actually pinning this muscle that is in between the ribs on the inside. So this is the internal intercostal muscle associated with pulling the rib cage down, so it is to assist in exhalation. Whereas on the opposing side over here, we have this green pin pinning the muscle on the outside in between the ribs, and so that's the external intercostal, which will actually pull the rib cage upward to assist in inhalation. Now down here we have a red and white pen, which is actually pinning this blood vessel coming across here. You can actually see these little red blood vessels here. And those red blood vessels that are coming across are the intercostal arteries. And this happens to be in the front. So this is the anterior intercostal artery. So that's what that is. Right here. So that's it right there. Then over here we have this muscle right here, which is labeled with the blue and white pen, which would be the diaphragm. So that's the diaphragm. And then on the inner area of the diaphragm right there would be the blue blood vessel that we've already talked about, which would be the inferior phrenic, although the inferior phrenic is busted there, so it looks like just a blue spot. But I will have cats that actually have a nice inferior phrenic. I've already shown you those on the other cats for the second exam. So this area is just depicting the area where the inferior phrenic would be.
Inferior phrenic?
Inferior phrenic vein, yes. All right, and that is it for the blood vessels and the structures associated with the respiratory system.